An update on the president as he wakes up in a Maryland hospital after being diagnosed with coronavirus. The president was flown to the Walter Reed National Military Medical Center last night in what the White House called an abundance of caution.
Mr. Trump is said to be doing well despite being fatigued and having a low-grade fever. His treatment comes as more members of his inner circle also test positive for COVID.
Overnight, we learned President Trump's former aide, Kellyanne Conway, and his campaign manager, Bill Stepien, have been infected. They joined two members of the Senate Judiciary Committee, First Lady Melania Trump, GOP Chair Ronna McDaniel, and longtime aide Hope Hicks.
This morning, there is renewed scrutiny of a White House Rose Garden ceremony. Most of this group appeared without wearing masks at the president's announcement 1 week ago of Amy Coney Barrett as his nominee for the Supreme Court. Chip Reid begins our coverage this morning. He's at Walter Reed. Chip, good morning to you.
Well, good morning. The White House released a statement overnight from the president's doctor saying he is doing well and, quote, that he did not require any supplemental oxygen. The statement also said the president is now being treated with remdesivir, which has shortened the recovery period for some COVID-19 patients. And the president also tweeted for the first time since he arrived here. He said, "Going well, I think. Thank you to all. Love."
President Trump arrived at Walter Reed at 6:30 Friday night, less than 24 hours after testing positive for COVID-19. Earlier, he walked out of the White House wearing a mask as he headed to Marine One for the short flight. White House Press Secretary Kayleigh McEnany said the move was done out of an abundance of caution and at the recommendation of his physician and medical experts. The president will be working from the presidential offices at Walter Reed for the next few days. Before departing the White House, the president taped this video message.
I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out.
In a statement, the president's physician, Dr. Sean Conley, said he was given an infusion of Regeneron's antibody cocktail, an experimental COVID treatment which has shown promising results in some clinical trials. The president and first lady were diagnosed after one of the president's closest aides, Hope Hicks, tested positive on Thursday for coronavirus.
We're rounding the turn.
Hicks had been on the road with the president, who traveled to 5 states during a busy week of campaign events, including Tuesday night's debate. McEnany claimed White House officials authorized the president's travel Thursday to a New Jersey fundraiser where he met with dozens of donors.
White House operations made the assessment it was safe for the president in consultation with others.
Now, White House medical staff are scrambling to identify those who might have had contact with Mr. Trump.
I fully expect that as this virus continues to go on, other people in the White House will certainly have a positive test result, and we've got the mitigation plan in place to make sure.
Here at Walter Reed, the president is staying in an enormous medical suite with all the medical bells and whistles. It's been described to us as a mini hospital and a home away from home. Michelle?
All righty, Chip. Thank you so much.